Perinatal mortality, encompassing stillbirths and early neonatal deaths, is a stark reminder of healthcare disparities worldwide. The loss of a child during this delicate period represents a profound tragedy for families and a significant public health concern. Understanding the scale of this issue is crucial for effective intervention. Globally, millions of families experience the heartbreak of perinatal mortality. The World Health Organization estimates that 2 million stillbirths occur annually, with an additional 2.4 million neonatal deaths within the first month of life. These figures represent an average, masking the stark disparities between developed and developing nations. While high-income countries have made significant strides in reducing perinatal mortality, low-income countries continue to bear a disproportionate burden. The reasons for this disparity are complex and multifaceted, reflecting broader issues of poverty, access to healthcare, and quality of care. Addressing perinatal mortality requires a comprehensive approach that considers the social, economic, and healthcare contexts of vulnerable populations. Zimbabwe, like many developing nations, faces significant challenges in reducing perinatal mortality. The country's perinatal mortality rate remains alarmingly high, reflecting the urgent need for improved healthcare infrastructure and access. Various factors contribute to this crisis, painting a complex picture of interconnected challenges. Limited access to quality prenatal care, inadequate healthcare facilities, and a shortage of skilled healthcare professionals all play a role. Furthermore, underlying health conditions prevalent in the region, such as HIV/AIDS and malnutrition, exacerbate the risks associated with pregnancy and childbirth. These factors converge to create a perfect storm, jeopardizing the lives of mothers and newborns. Addressing perinatal mortality in Zimbabwe requires a multi-pronged approach that tackles both the immediate healthcare needs and the underlying socioeconomic determinants of health. Empowering women with knowledge and access to quality healthcare is paramount in the fight against perinatal mortality. Maternal education plays a pivotal role in improving pregnancy outcomes. Educated mothers are better equipped to make informed decisions about their health, recognize danger signs during pregnancy, and seek timely medical intervention. Prenatal care provides a crucial window of opportunity to monitor the health of both mother and baby, identify potential complications, and provide essential interventions. However, in many resource-constrained settings, access to quality prenatal care remains limited. Barriers such as distance, cost, and cultural beliefs often prevent women from receiving the care they desperately need. Addressing these barriers requires a multifaceted approach, including community-based health initiatives, financial assistance programs, and culturally sensitive healthcare services. Section 4. Building a healthier future healthcare infrastructure and personnel. Strengthening healthcare infrastructure and ensuring a skilled healthcare workforce are essential pillars in reducing perinatal mortality. Well-equipped hospitals, particularly in rural areas, are crucial for managing high-risk pregnancies and providing life-saving interventions. Investing in neonatal intensive care units, or NICUs, is equally important for providing specialized care to newborns facing complications. However, infrastructure alone is insufficient without a skilled and dedicated healthcare workforce. Training and retaining skilled midwives, nurses, and doctors, particularly in rural and underserved areas, is paramount. Investing in healthcare education and providing incentives for healthcare professionals to serve in remote areas can help address the shortage of skilled personnel. Section 5. A collaborative approach, recommendations, and global partnerships. Reducing perinatal mortality requires a global commitment and collaborative action. International organizations, governments, healthcare providers, and communities must work together to address this pressing issue. Strengthening healthcare systems in developing countries, particularly in rural areas, is paramount. This includes improving access to quality prenatal care, skilled birth attendants, and emergency obstetric care. Investing in maternal education, promoting family planning, and addressing underlying health conditions such as HIV/AIDS, and malnutrition are equally crucial. Global partnerships can facilitate the sharing of knowledge, expertise, and resources. By working together, we can strive to create a world where every pregnancy is cherished and every child has the opportunity to survive and thrive.